Lisbeth Dendas, you're the Public Affairs Manager for Animal Health Europe, the voice of animal medicines and veterinary medicines here in Europe. Last week, the European Parliament adopted the animal medicines package. Is this welcomed by your organisation?
Yes, absolutely. So the animal medicines package consists of actually 3 pieces of legislation. It concerns veterinary medicinal products, but also medicated feed. So we're very happy to see the Parliament adopt this legislation, and we're looking forward to also an adoption by the Council in the coming weeks.
One of the major concerns was antibiotics and antimicrobial resistance. Do you think that farming is contributing to this problem?
Indeed, antibiotic resistance is a very big global challenge. It is something that our industry also is actively seeking to contribute to finding solutions for this challenge. It needs to be said, obviously, that it's not only a challenge for veterinary medicines, but also for public health. And this means that indeed we are all trying to work together to find solutions. It has at this point not really been established what exactly the use of antibiotics in animals means in terms of antibiotic resistance in humans. This hasn't yet been established, but nonetheless it is very important for our sector to also do what we can to reduce any potential for resistance in animals.
Do you think that there is bad practice at this moment? Do you think that antibiotics are prescribed in a way that is really compensating for poor animal husbandry and poor animal welfare?
The animal health industry very clearly is committed to promoting the responsible use of antibiotics in animals. So where obviously it cannot be ruled out that there might be instances where there is poor practice done for the use of antibiotics in animals, this is certainly not a practice that we support or advocate. So we are firmly actively trying to promote the responsible use through training programs, through guidelines that we provide. So this is absolutely something we're trying to combat as well.
What does it mean for third countries, those producing medicines outside the EU?
In fact, it is so that the new legislation introduces what we refer to as a reciprocity clause. This means that the legislation foresees that specific restrictions can be placed on the import of animals that have been treated with antibiotics that are considered by Europe as critically important antibiotics, or at least that they will be considered as such, because this list, these rules are not yet in place. So the new legislation foresees a clause like that. This will obviously have what we expect to be trade implications, and it is something that definitely needs to be examined further through the WTO in particular, and we think this is something that needs to be checked with the SPS committee that will really evaluate what exactly will be the impact of this new rule on trade.
So the SPS committee, that's the committee that deals with animal health issues in the WTO. Will that organisation consider it? Is it likely to consider it as a protectionist measure?
At this point, we are just seeking to have some clarification on exactly what will be the implications of the new rule.
There are other parts to this agreement. One of them includes longer intellectual property protection for those who develop new medicines. Has that been welcomed by your industry?
Yes, absolutely. We have been asking for new measures to really improve, to boost innovation in our sector, because it is much needed already for some years. So we're very happy to see that the new regulation foresees a number of measures that will hopefully boost innovation in our sector in the next coming years and decades, actually.
How is this package being received by farmers and by veterinarians on the ground?
I think we are all looking very much forward to the new rules actually improving the availability of veterinary medicines in Europe, because as I noted before, this is something that we've been having problems with, specifically the availability in the smaller member states. That has been an issue historically, but also, for instance, making sure that also the minor species, those animal species that have not had specific medicines for their species available at this point in time, that they will have better medicines suited specifically for them in the future.